Welcome to everyone. One of the most effective and evidence-based exercises for erectile dysfunction, premature ejaculation, and overall pelvic health that I recommend to my patients is pelvic floor muscle training, commonly known as Kegel exercises. However, many men perform these exercises incorrectly, and if done wrong for extended periods, they can actually worsen your symptoms rather than improve them. When performed correctly, these exercises can significantly improve erectile function, ejaculatory control, and urinary health within just a few weeks. Today, I'll explain the proper technique for pelvic floor exercises and share the critical stretching component that most men overlook, a component that can dramatically enhance your results and prevent the common mistakes that lead to treatment failure. Hi, I'm Dr. Jocelyn, urology and men's health expert. I help men improve performance, protect their prostate, and feel their best at any age. First, let's discuss the science behind why pelvic floor exercises work, because understanding the anatomy will help you customize your routine for optimal results. Your pelvic floor is a complex network of muscles that form the foundation of your core and support multiple vital functions. These muscles literally form a hammock-like structure that supports your bladder, rectum, and, in this case, most importantly, the base of your penis and prostate. Think of your pelvic floor as a muscular basket that cradles and supports your reproductive and urinary organs. When these muscles are functioning properly, they provide structural support, help maintain continence, and play a crucial role in sexual function. The bulb spongiosus muscle, in particular, wraps around the base of your penis like a supportive sling. This is the muscle responsible for the rhythmic contractions you feel during ejaculation and the muscle that allows you to bounce your penis when erect, a sign of good pelvic floor function that many men lose as they age. Research published in the British Journal of Urology International shows that when the bulbospongiosus and related pelvic floor muscles are strong and responsive, they help trap blood in the erectile chambers during erection, leading to firmer, more sustainable erections. However, if these muscles are weak, you may experience venous leakage, where blood flows out of the penis too quickly, leading to difficulty maintaining erections. Conversely, if these muscles are too tight and unable to relax properly, they can restrict blood flow and also impair erectile function. A landmark study published in the Journal of Sexual Medicine followed 55 men with erectile dysfunction who performed pelvic floor exercises for 6 months. The results were impressive. 40% of participants regained normal erectile function, and an additional 35% showed significant improvement. But here's what most men don't understand, and what many healthcare providers fail to explain. Pelvic floor training isn't just about strengthening, it's about achieving the right balance of strength and flexibility. Many men make the critical error of focusing only on strengthening these muscles without addressing flexibility and relaxation. This is like going to the gym and only doing bicep curls without ever stretching. You'll build muscle, but you'll lose range of motion and functional capacity. Let me help you determine what type of pelvic floor dysfunction you might have, because the solution depends on your specific issue. You may have hypotonic pelvic floor dysfunction, which means low muscle tone. In this case, your pelvic floor muscles lack strength and endurance. Signs include weak urine stream, difficulty maintaining erections, premature ejaculation, and feeling like your erections lack firmness or support. Alternatively, you may have hypertonic pelvic floor dysfunction, which means excessive muscle tension. Here, your pelvic floor muscles are chronically tight and unable to relax properly. Signs include delayed ejaculation, difficulty starting urination, chronic pelvic pain, and erections that feel restricted or uncomfortable. Most men actually have a combination of both. Some muscles may be weak while others are overly tight. This is why a comprehensive approach that includes both strengthening and stretching is essential. Research published in the International Journal of Impotence Research confirms that men with mixed pelvic floor dysfunction respond best to combined strengthening and flexibility training rather than strengthening exercises alone. Now, let's discuss the proper technique for pelvic floor exercises. First, you need to identify the correct muscles. The easiest way is to stop your urine stream midway. The muscles you use to do this are your pelvic floor muscles. However, don't regularly practice stopping urination, as this can lead to incomplete bladder emptying. Another way to locate these muscles is to tighten the muscles you would use to prevent passing gas. You should feel a lifting sensation in your pelvic area without tightening your buttocks, thigh muscles, or abdominal muscles. For basic pelvic floor strengthening, contract these muscles for 3 seconds, then relax for 3 seconds. Start with 10 repetitions 3 times daily. Gradually increase to holding for 10 seconds with 10-second rest periods, working up to 3 sets of 10 repetitions daily. The key is progressive overload. Just like any muscle training program, studies show that it typically takes 6 to 8 weeks of consistent training to see significant improvements in muscle strength and sexual function. However, and this is crucial, strengthening alone is insufficient. You must also incorporate pelvic floor stretching and relaxation techniques. This is where most men fail, and it's why some men actually get worse with pelvic floor exercises. Think about it logically. Would you train any other muscle group without ever stretching? Of course not. Yet, most pelvic floor exercise programs completely ignore the flexibility component. Let me share 3 evidence-based stretching techniques that complement your strengthening routine and can dramatically improve your results. The first is what's called the supported child's pose modification. Lie on your back on a firm surface, like a yoga mat. Bring your knees toward your chest and grab your feet or ankles, creating a position similar to the yoga happy baby pose. This position gently stretches the pelvic floor muscles, hip flexors, and lower back muscles that can contribute to pelvic floor dysfunction. Hold this position while taking 5 deep breaths, inhaling slowly through your nose and exhaling through your mouth. The deep breathing is crucial because it activates your parasympathetic nervous system and helps your pelvic floor muscles relax. Research in the Journal of Bodywork and Movement Therapies shows that diaphragmatic breathing directly influences pelvic floor muscle tension. The second technique is the deep squat stretch. Stand with feet slightly wider than hip width apart and slowly lower into a deep squat position. Place your forearms on the inside of your thighs and gently press outward while maintaining the squat. This position stretches the deep hip muscles, opens the pelvic outlet, and encourages pelvic floor muscle lengthening. Hold for 30 seconds while focusing on deep, relaxed breathing. If you have knee or hip limitations, you can modify this by sitting on the edge of a chair and leaning forward, or by placing a small pillow under your heels during the squat. The third technique involves what we call targeted muscle release using a therapy ball. This technique, while less conventional, has shown remarkable results in clinical practice for men with chronic pelvic floor tension. Using a lacrosse ball or similar firm therapy ball, you can perform gentle release work on the muscles around your pelvic floor. This should be done carefully and gradually, and I recommend learning the proper technique from a qualified pelvic floor physical therapist if you're interested in this approach. The key principle is that your pelvic floor muscles need both strength and flexibility to function optimally. Clinical studies show that men who combine strengthening exercises with flexibility training see significantly better results than those who only focus on strengthening. A study published in Urology and Urodynamics followed men doing traditional Kegel exercises versus men doing combined strengthening and stretching routines. The combined approach group showed 65% better improvement in erectile function and 40% better improvement in ejaculatory control. Here's my recommended routine for optimal pelvic floor health. Perform your strengthening exercises daily, 3 sets of 10 contractions, holding for 5 to 10 seconds each. Incorporate stretching at least 3 times per week, preferably after your strengthening routine when muscles are warmed up. Always begin with 5 minutes of deep breathing and gentle movement to prepare your muscles. End each session with relaxation techniques to ensure your muscles return to their resting state properly. Most importantly, be patient and consistent. Research shows that significant improvements in sexual function typically occur after 8 to 12 weeks of consistent training. Some men see improvements earlier, but full benefits usually require 3 months of regular practice. If you've been doing pelvic floor exercises for months without improvement, or if your symptoms have worsened, you likely need to add the flexibility component or modify your technique. Consider working with a pelvic floor physical therapist who can assess your specific muscle function and customize a program for your needs. And before we wrap up, I want to be clear. There are a lot of poor quality supplements out there, especially ones pushed on adult websites that can be a waste of money or even harmful. That's why I only recommend trusted, clinically backed supplements. You can check them out in the pinned comment in the description below. Remember, just as you wouldn't train any other muscle group without proper form and balanced programming, your pelvic floor deserves the same comprehensive approach. The combination of appropriate strengthening, targeted stretching, and proper breathing techniques can dramatically improve your sexual function, urinary control, and overall pelvic health. These exercises aren't just about sexual function. They're about optimizing a crucial component of your core stability and overall health. A well-functioning pelvic floor contributes to better posture, reduced back pain, improved athletic performance, and enhanced quality of life. If you're experiencing persistent pelvic pain, difficulty with urination, or sexual dysfunction that doesn't improve with these exercises, don't hesitate to consult with a urologist or pelvic floor specialist. Sometimes underlying conditions need to be addressed before exercise therapy can be fully effective. Take care of your pelvic health, just like you would any other aspect of your fitness and wellness. With the right approach, consistency, and patience, most men can achieve significant improvements in their pelvic floor function and overall sexual health. Remember, you're investing in your long-term health and quality of life.